So now we're going to start the discussion about the upper limb. So how we're going to proceed the upper limb? See, first we discuss some muscles in the pectoral region, and then we go to muscles of back, and we discuss the muscles acting around the scapula and shoulder joint. Fine. And then we discuss the brachial plexus. After the brachial plexus, we discuss the main three nerves: radial nerve, median nerve, and ulnar nerve. While discussing the nerve, side by side, we discuss all the compartment muscles: front of arm, back of arm, front of forearm, back of forearm, palm, everything we discuss. Okay. So first, we're going to discuss some basic points. Now, the development of upper limb. See, upper limb is upper limb bud, which is appearing by the end of 4th week. So, some points about the development. So, first point, upper limb bud, which appears by the end of 4th week. Fine. Now, what about the lower limb? By the beginning of 5th week, just 1 week later. So, lower limb bud appears in the early 5th week. Right. So, first point over. Next, what about the muscles? What about the bones? Next, muscles. The skeletal muscles of upper limb, muscles of lower limb, they are coming from, very good, myotome of the somites. Myotome of the somites. Fine. What about the bones? The upper limb bones, lower limb bones. The appendicular skeleton is coming from the bones of upper limb and lower limb. They are coming from lateral mesoderm. Which layer? Somatic layer of lateral mesoderm. Appendicular skeleton. The bones of upper limb and lower limb, they are coming from somatic layer of lateral mesoderm. Somatic layer of lateral mesoderm. Fine. So these are the basic points about the development of upper limb and lower limb. Upper limb bud by 4th week, lower limb bud just 1 week later, 5th week. Muscles, both the muscles, upper limb and the lower limb muscles are coming from myotome of the somites, and the appendicular skeleton bones are coming from somatic layer of lateral mesoderm. Somites are coming from paraxial mesoderm. I hope you know that. Paraxial mesoderm. Fine. Now, next, dermatome of the upper limb. Right. See the diagram. Now, in the diagram, the shoulder, highest point of the shoulder, tip of the shoulder is supplied by C4 fiber. So, C4 fiber dermatome for the tip of the shoulder. Okay. Now, phrenic nerve, what is the root value of the phrenic nerve? Phrenic nerve root value is C3, C4, C5. C3, C4, C5. The bulk of the phrenic nerve is coming from C4 only. The same C4 is a dermatome for the tip of the shoulder. Okay. So, when the phrenic nerve is irritated, the pain will be referred to tip of the shoulder. So, please write. When the phrenic nerve is irritated, pain referred to tip of the shoulder. Pain referred to the tip of the shoulder. Okay. Right. Next point. Now, see the diagram. So, in the diagram, yes, we are seeing the dermatome of the upper limb. Now, this is a chest region. Fine. And so, this is medial side and this is lateral side. Okay. Now, C5 fiber, which carries sensory fiber from the lateral aspect of the arm. So, C5 fiber, lateral aspect of the arm. Fine. C6 fiber, lateral aspect of the forearm and thumb. So, point is C6 fiber, lateral aspect of the forearm plus thumb. Right. Next, the middle three fingers, C7. So, C7 is a dermatome for the middle three fingers. Fine. Next, little finger plus the medial aspect of forearm, medial side of the forearm, C8 fiber, carry the fiber from the little finger and the medial side of the forearm. Okay. Then the medial side of the arm, sensory fibers are carried by T1 fiber. So, this is medial side of the arm. Again, only lower part, sensory fibers are carried by T1. Okay. So, please remember C5 lateral aspect of the arm, C6 lateral aspect of the forearm including thumb, middle three fingers C7, C8 little finger and the medial side of the forearm, then the medial side of the arm, the lower aspect by T1 fiber. Now see the T2 fiber. See T2 fiber which is carrying the sensory fibers from chest, axilla and also the uppermost aspect of the arm, medial side. So this nerve is called intercostobrachial nerve, supplying the chest and the arm. So T2 fiber supplies the upper side of the medial arm, the upper part of the medial side of the arm, axilla and also from the chest region. Okay, so that is why T2 nerve is called intercostobrachial nerve. Okay, so these are the points you have to know about the dermatome of the upper limb. Next, one more small thing we're going to discuss in the introduction topic. We're going to discuss the transmission of weight from the upper limb to the trunk. How the weight is transmitted from the upper limb to the trunk. For this, we have to know some basic points about the clavicle. So clavicle, it is the modified long bone. It is a long bone, but it is modified long bone. Why, sir? Because clavicle, it is not vertically placed. Clavicle is horizontally placed. It is horizontally placed long bone. It is horizontally placed. And you can feel the clavicle. It is subcutaneous, just below the skin, which is subcutaneously placed. Okay. Number 3, no medullary cavity. No medullary cavity. And another important point, it is ossify from membrane. No endochondral ossification. So clavicle ossify from membrane. Okay. So because of these 4 points, we are saying clavicle as a modified long bone. This is the diagram. Now clavicle is having 2 ends. This is the medial end of the clavicle and this is the lateral end of the clavicle. Now medial end of the clavicle is called sternal end and the lateral end of the clavicle is called acromial end. Okay. The sternal end articulate the sternum and form sternoclavicular joint. Now sternoclavicular joint, what type of synovial? So sternoclavicular joint, it is saddle type of synovial. Sternoclavicular joint is saddle type of synovial. Okay, right. Now what about the acromioclavicular joint? See, acromioclavicular joint, it is plain type of synovial. Acromioclavicular joint is plain type of synovial. Acromioclavicular joint is plain type of synovial. Okay. See the exams, the recent exams from 2018, I am saying we are getting one question from the joints and the examples. They give some joint and they'll ask you the type, or they give some type and they will ask the what is the joint. Okay. So please remember, sternoclavicular, it is saddle type of synovial. Acromioclavicular, plain type of synovial. Now see the ligament. Now this is our clavicle and this is the acromion process. So acromion process articulating with the acromial end of the clavicle to form acromioclavicular joint. Now acromioclavicular joint, what are the ligaments? Acromioclavicular joint. Acromioclavicular ligament. Acromioclavicular ligament. Okay. And we also have coracoclavicular ligament. Coracoclavicular ligament. So 2 ligaments are involved, okay, in this joint. Now from sternum to clavicle, I told you sternoclavicular joint. So sternoclavicular joint, what are the ligaments? Sternoclavicular ligament and costoclavicular ligament. Sternoclavicular and costoclavicular ligament. Right. So now these are the ligaments involved in these 2 joints. Right. So now weight from the upper limb be given to scapula bone via shoulder joint. This is shoulder joint. So now how the weight is transmitted? So from the upper limb, the weight is transmitted to scapula through which joint? Shoulder joint. Through shoulder joint. Now from the scapula, weight is given to clavicle through, just now I told you, acromioclavicular joint. Acromioclavicular joint. Okay. Now, from the clavicle, weight is given to trunk, sternum, through sternum via sternoclavicular joint. Now, what are the ligaments which are transmitting the weight from the upper limb to the trunk? Okay. So, what are the ligaments involved in weight transmission? Just now I told you. What are the ligaments involved in weight transmission? Number one, acromioclavicular ligament, coracoclavicular ligament, sternoclavicular ligament, costoclavicular ligament. These are the ligaments which are transmitting the weight from the upper limb to the trunk. Okay. The question is, which ligament is not involved in the weight transmission from the upper limb to the trunk? Now we have one ligament. Now see this ligament. This ligament is coming from acromion process to the coracoid process. So these are the ligaments involved in weight transmission. You have to know one more ligament. Now that ligament is not transmitting the weight. What is that? That ligament is connecting the two processes of scapula. This is the acromion process. This is the coracoid process. So between these two processes, we have coracoacromial ligament. So coracoacromial ligament, it is not involved in weight transmission. Please write. Coracoacromial ligament, it is not involved in weight transmission. Okay, not involved in weight transmission. Okay, so this is how the weight is transmitted from the upper limb to the trunk. One last point, and then we can start discussion about the pectoral region. Now, fracture of clavicle is seen at the junction between medial 2/3 and the lateral 1/3. Why, sir? See, medial 2/3 of the clavicle, it is round shape. Lateral 1/3, it is flat. So fracture is most commonly seen at this junction only. So fracture of clavicle is most commonly seen at the junction between medial 2/3 and the lateral 1/3. Okay. So these are some basic points you have to know in the introduction topic.